So a warm welcome to everybody joining our session here in the frame of the IHE-Europe experience sessions on the Global Consortium for eHealth Interoperability. My name is Jürgen Brandstätter. I'm from IHE International and one of the 6 members of the consortium's executive board. So I'm now going to share my slides. Please allow me a second. So I hope you see it now. Yes, this is the welcome session. So in my session, I will try to give you a short overview of what the Global Consortium for eHealth Interoperability actually is and what's its purpose. And we also have a short recap to find into today's program on repeating our last successful listening session on the different vaccination certificate initiatives of the European Union, the WHO, and the US. So what's the journey today? So everyone is moving to digital health. And what we see at the moment is that there are so many eHealth use cases to implement. And not only to implement, but to implement them in a long-term way, in a cost-effective way, in other words, in a sustainable way. And we see alone the COVID crisis has revealed so many different eHealth use cases that the different states would have needed or partly have already had. But to our knowledge, most of the eHealth use cases like bed reporting, where are ICU units, supply chain things like where do we have equipment and all of that, were pretty, not so good implemented in the different countries. So there is a lot of work ahead. And what we all need here is convergence, because countries, especially during the crisis, have started to create solutions, obviously, because they needed to, but they are partly quite different. So we need to converge that in a way, and we need to anymore enter on this convergence path as we actually already do. So what means convergence? Convergence means on a global scale, where we already have some standards, that we develop implementation guides on how to use them. So in other words, what we need is blueprints. We need some kind of, this is the way how to do it things, which can be distributed on a global scale. So how does a blueprint get into being? So on the one hand, you have an eHealth use case and you have the standards, and all those go into a funnel. And then, as we have seen in COVID now, trials start up. This country does a project, the other one does a project to cover this and so on. And some are practicum, some are more practicum, some fail, some succeed, some have a better usability. But at one point of time, we need to assemble on a global stage and start to do some harmonization work. Because with this harmonization work to harmonize all these different solutions into some globally accepted ones, we get some more cost efficiency, which raises acceptance. And once this reaches a point where we can say, this is pretty much globally accepted, then we speak of a blueprint. So in other words, a blueprint is the globally accepted way how to do it for one specific use case. And we have many of them, as I said already. So we have patient identification, audit, document sharing, many use cases where FHIR steps in to transfer data exchange and so on. So there's really a lot of work ahead, and ideally, they assemble together as like in this puzzle game, so that they all fit together and can be combined and complement each other. For example, because logging and audit on in a national project, you need on a very crucial level, and you need to audit all of your data exchanges, not particular ones. So ideally, this is one component which magically fits to the others. So this is what we should work on. And why should we work on this? Because policymakers need exactly those blueprints. I give you an example. The European Commission, for example, has issued the eHealth digital service infrastructure for cross-border exchange of patient summary, e-prescription and e-dispense. And they are now working on the next phase, so to speak, and talk about EHR exchange formats for medical imaging and reports, laboratory results, and hospital discharge reports. And you see, these are all use cases you probably know of in your own country as well. So this is cross-border now. So it's a very, very large scale. So for a policymaker to establish specifications like that is highly advised that they base on some established standards and on established blueprints. In this case, for example, on IHE profiles with CDA content, but in parallel, there is already development on FHIR. So these are the blueprints we are talking about. And on these blueprints, such large-scale specifications should be based on. Otherwise, a policymaker like the European Union could never, ever recommend that and issue that to be used by 27 member states. That would lead to total not sustainability, so to speak. And for FHIR, we are actually working on establishing those blueprints. FHIR is the standard of the future, that's without no doubt. And there are already many use cases which use FHIR already. And we need to intensively accelerate that and work on that so that they establish to the future blueprints for the different future eHealth use cases we have. So what we definitely need to support this setting from before is that we need a kind of a policymaker SDO partnership. Because the SDO, this is the picture now, they are developing the base standards, they are profiling them, and they try to drive the solution into production, into the market. But if they do that disconnected from the policymakers and the one who use these standards, this is, let's say, medium efficient, so to speak. And it does not generate the speed which we currently need to cover all of these upcoming pressing eHealth use cases. So what we need is that the policymakers engage into this. So they need to communicate with the standards development layer and give them their requirements, like kind of steer and guide the development of the standards in order, guys, this is what we need. So please, could you work on that, you know? And on the other hand, once the standards community delivers, exactly those other guys from before promise the uptake. They say, okay, thank you what you did here, because we take that now and establish our specifications on top of it. And this is particularly important for the motivation, because as you know, all the standards development organization layer is a kind of a highly committed set of persons who do that on a volunteer basis. And they really suffer if they create something for vain, you know, they would work much better, so to speak, if they would see that there is an actual uptake at the end. So the Global Consortium for eHealth Interoperability, what is it and for what was it created? So in short, it was an exercise to team up and to combine the assets of the three different organizations, HIMSS, HL7, and IHE, to one bundle, to one initiative, which can be the contact point for exactly what was on the slide before, that a governance body, a policymaker has an address to start to give their requirements to, or to start some questions. So the consortium is obviously working into the field of advancing interoperability and also interoperability deployments. And we want, of course, to accelerate and drive forward the emerging of the interoperability standards. In particular, of course, FHIR, since this one is the, let's say, the standard of the future. These are our core principles. So we want to achieve implementation-ready standards in the final end. So we know that this requires more just as just a piece of paper or a specification here and there. It needs some things around it, like test tools, like education, like webinars, like all of that. And you know, we thought that as a bundle of three, we can coordinate these creations of these things and use the different strengths of the different organizations more efficiently to increase our speed. Of course, providing clear guidance, that's also an important topic, because the market is sometimes confused about the different standards development organizations. You know, they don't know what is their direction, what is their purpose, what is their intention, you know. With this teaming up, we want to create a kind of a unified voice. We speak with one voice to also give the signal to the market and the confidence that what's spoken out of this mouth is somehow approved by all of these three organizations. So I have the confidence that I'm now not trusting the one and maybe in a month the other one says something different. We are accorded. We felt that we need to provide this service to the market, to be accorded, to be clear, to be a reliable a partner and message according to standards to the market, to the vendors, and to the users of the standards. And of course, as I said before, we have a lot of new eHealth use cases ahead. That means we have a lot of early adopters. So the ones who is starting first with covering one or the other eHealth use case is an early adopter. You know, the one who comes as 8 can already copy and paste from the others, especially from the successful ones. So we are in general in an early adopter phase, because the whole ecosystem is still, you know, building up. I mean, that sounds a bit strange, since we are working for decades on eHealth. But we must not forget that health is becoming quite right now, you know. So the eHealth use cases are popping up right now, and this is gaining speed and not reducing speed. So we must realize that we are on the start of a journey which probably lasts for the next 2 or 3 decades, and not at the end. So this graphic shall kind of visualize what I said before. So we have the global scale. So the Global Consortium, as the name says, is global scale. So we have the world up there, and there are entities out there, like you have seen countries, you have seen in the icons, ADB, the Asian Development Bank. You have you see now the Global Digital Health Partnership. These are all entities which are multinational, for example, or working in a wide area, like the Asian Development Bank has all Southeast Asia and all Central Asia. And so these are gigantic areas they are working in. And they move a lot of money, you know, they have donor money, they have money from well-developed countries, which they want to give to not well-developed countries. And these investments need to be channeled. So these are actually the entities we would like to offer ourselves as being a contact point for exactly what I said before. Please provide to us your requirements. Give us your support, because it's crucial that we get not just a pile of paper. You know, these are our requirements. Thank you very much. We need the active contribution of these guys. So we want to engage them also in terms of workforce. We want to get them as partners, at least for a part, so that they convey their requirements and also make sure that their requirements are met during the course of the creation process of the standards on the other layer. This is what we mean with support and contribution. And the last is funding, because we have seen the standards development process is, as I said, volunteer. So that's great, because it's neutral, and you can be sure that what comes out here is the best of breed and not biased, so to speak. On the other hand, this volunteer base is a bit limited, because it's volunteers. You know, if they do something, it's great. If not, there is no, you know, there's not, you cannot shake it out of them. So what we need is funding to cover the basic work steps of the creation of a standard, because the standards creation is a lot of brain work. But and for that, you need all of these volunteer experts. And we are so thankful that they give their brain and that they give their experiences. But what it also needs is a lot of writing work, a lot of reviewing work, a lot of project management work. You know, you must conduct meetings, working groups, ballots, and all of that stuff. And these things, if those are funded, the resources are much more freed and can focus all the energy they have in doing what they actually should do, give their brain and give their experience to create the best possible outcome on standard and implementation guides you can get. On the other hand, all these partners from above promise the uptake. So if they commit on the left side to give their requirements and their contributions and their funding, it's actually almost a bit clear that they also will use it later, which means that during the process of its creation, everyone working on that has a very good feeling because they know it makes some sense. You know, it's good. There will be some uptake. This will be really used. We need to, you know, give our best. So it's also a motivation issue. And once this enters the door at the Global Consortium, it's actually planned to divide the tasks between our three organizations mainly. HO7, for example, to work on fire resources, on new fire resources which we need, or on improving one or something like that. IHE on test tools, HIMSS on webinars and education material, as it requires. And also the consortium is not only us three, it is a community. We are starting up a participation model where governments, for example, but also stakeholders like healthcare providers, or also some vendor associations, or even vendors and the private sector should be part of this community and contribute to the work level of the different work products. And again, the same in another picture, but maybe this makes it absolutely clear. So the requirements come to consortium. The consortium works out the package of profiles and implementation guides and standards, test tools, connectathons, which lead to tested products, which lead to a market, which lead to a market competition, meaning lower prices, and everything you need around it in terms of education. And this is what we say the starter kit for a country to create their own national specifications for this eHealth use case. Because if they have that, they can create that as efficient as possible. So we are not saying that we bring the solution to the different countries. That's an illusion. We know that there are always this step of, you know, turning it and converting it into your local needs is always needed, and it's always in the responsibility of the different countries. But we can make it as easy and as efficient as possible for them. And this is exactly our goal. So our projects are that we want to accelerate this pilot project. So this is actually the Global Health Standards Acceleration track or project, which is this session. We also want to support digital health programs if they need some help, as said before. One work item which we would like to do is a global master standards catalog. This could be, for example, a combined work item with the Global Digital Health Partnership mentioned before, because they actually have that on the list as a work item as well. But it's a lot of work. What we want to do here is a very precious thing. It should be a catalog which lists which standards, like kind of which blueprints, so to speak. So meaning standards plus implementation guides plus everything around it are actually used out there in the world successfully. And we are well aware that this will be a thin list at the moment, you know, maybe for some use cases, there are different solutions which we need to list equally. But we want this as a handbook for countries to read, okay, what is beyond the academic stage, what is already in operation, because we know that this operation step is a very hard step. Coming from a standard to a nationwide up and running and successfully running project is quite a long way. And with this Global Master Standards catalog, the reality should be enlightened. And the other are obvious. So we want to, of course, develop and access all of these interoperability tools, advanced global health equity. This is all around education, giving, for example, LMICs access to knowledge, which by, for example, giving them access to events like this. And of course, all in all, emerging interoperability as a whole. This Global Health Standards Acceleration Project has now been established on different connectathons. So we started at the IHE North America connectathon in March this year, and it followed the HL7 Fire connectathon in May. And now this instance is the IHE-Europe connectathon. So we are on the third line, so to speak, and the next one will be again on the HL7 Fire connectathon. So the purpose here is twofold. First, we have this acceleration project where everyone should attend who is interested in that. And it is sponsored, so to speak. It should also, there should be a low barrier to access. And also, it should be the signal to emphasize what I said in the beginning, that the Global Consortium is a true team up of these three organizations. And it's not on the list because it's not yet planned, but this Global Health Standards Acceleration Project will also be at an IMSIMENT at some point of time. So that everyone sees and also feels, and that we prove, yes, we are capable to drive forward a project across our three organizations, which up to now have actually worked totally distinctly from each other. You must realize that, but this changes now. And the other completed activity are listening sessions. So at the beginning of the pandemic, we started some listening sessions. These were 3 to interview at different healthcare providers, actually more focused on the US, on their experiences with the crisis. This was 2020, but we had one in 2021, which was for vaccination credentialing. And now I want to slowly lead over to the kind of the theme of this global health standards acceleration track, which is vaccination credentialing and all around vaccinations and immunizations. So we had in May this very successful listening session on vaccination credentialing, and we had Clayton Hamilton reporting on the WHO credentialing project, Brian Anderson on the US VCI credentialing project, and Konstantin Hyponen for the European Union. And there's the link to the recording. It's very interesting to listen to. As a short recap, and we have some sessions on that later for more details, so please see that really just as an overview. The European Union has its digital COVID certificate, the so-called Green Pass, and you see this is a certificate for access. So we want to let people move freely across the European member states here, and the type of certificates are vaccination certificates, obviously, but also test and recovery certificates. And this is a bit of a difference to the other 2 initiatives who have just vaccination certificates. This initiative has a very minimal data set because of the GDPR constraint, and everything of it is encoded in a QR code, which can be transported digitally or on paper. There will be a series of EU gateways where all of the signature validation keys can be exchanged. And let's say the goal is to have a European-wide validity, which is secure, which is digital signed. And the member states have committed to have this framework ready by summer 2021. And especially there's those countries who have a lot of tourism are especially interested in that. So there is let's say, a huge motivation to really implement that, and we are confident that this will be in full operation soon. All the specifications open source. It's based on open interoperable standards. And as a note, the dataset is a Fire bundle, for example. And you have some important links, so the main links here. So what we'll see now, if we switch over to the other initiatives, for example, the VCI, the Vaccine Credentialing Initiative of US, on which we have a special session later, to which I would like to point you out. There is so much overlap, it's for the same purpose, it's for access. It has just a vaccination certificate, it's not the other two, but they are pretty much the same. It's also minimal data set. It's also a QR code. It's also digitally or paper-based. What they have, and I think that's a good move, is that they teamed up with some digital wallet suppliers to have also the digital storage of this, or for example, on the phone of the different individuals, is kind of, there is already used something which is already there. The difference is maybe that this is a private sector-led effort. So this is a bottom-up approach, if you want, but the bottom-up is relative because there are really big US stakeholders involved, like Mayo Clinic or Microsoft, real big players in the scene, but still it is bottom-up, and it's not like the European Union project, something which is coming down from the policy level. It's bottom-up. So that because it's bottom-up, it's a voluntary coalition of public and private organizations. And the plan is that it unfolds so much benefit for the different participating organizations and also of the citizen, that it gets enough energy to be successful. At the bottom, again, the links. And lastly, before I close, the WHO Smart Vaccination Certificate, SVC, on which Clayton Hamilton explained exactly that this one has the same purpose as the others for access, but it has another purpose. It's for continuity of care. That's another difference. Because WHO says, okay, we need to take care on all of these LMIC countries, and most of them we must realize that they have not so much going on in eHealth yet, and we need to support them. So which is why they created their specification also for the purpose of continuity of care. So, but basically it's the same. It's a vaccination certificate based set which documents the vaccination status of a patient or of a citizen or of a person, so to speak. It is also minimal data set, obviously. It's also QR code based. And the WHO, in terms of transport, they want to establish a public key directory for this cross-border exchange of the keys. And also the specification is open source and based on interoperable standards. In that case, on IHE profiles and the international patient summary, FHIR-based, plus the open HIE architecture, which is very let's say, very common and very well known in especially the LMIC countries, which is a real good framework in how to establish a health information exchange in a country. So by that, I'm in the finishing. So the last question, and I hope that the next sessions will maybe give an answer on that, is how to get them all. So we have now heard these three different initiatives, VCI in US, the European one, and the WHO one, which is kind of global. But there are large areas which you have not yet interviewed, for example, Asia or Latin America. So the next step for the consortium is to do this one little part here, to conduct the next listening session regarding that in the Asia Pacific region. And you are all invited to join. This will be, again, free of charge. It's on July 15th in a time zone which is convenient for Asia, obviously, not so much convenient for US, but since it's an Asian-centric listening session, we of course needed to make it as convenient as possible for our Asian colleagues. And we have India, for example, presenting there. And I mean, these are large markets. India has 1.2 billion or 1.3 billion people, you know. So we need to know what they are doing. And the final question is, since travel is global, how do we get all of that connected? And with that cliffhanger, I thank you very much for that, for your attendance to this interesting session or series of sessions, which is now starting up with a panel. And I would like to introduce and moderate over to my dear colleague Didi Davis from IHE International, who is the other one in the Global Consortium's executive board, who will moderate the next panel. Didi, please take over. Thank you very much.
Thank you, Jürgen, and wonderful presentation. And welcome, everyone. Thank you for taking time out of your valuable day to be with us. I have the distinguished pleasure of introducing our panel. Our panel is made up of 4 members. I'm just going to introduce them all now and then turn it over to the first panelist to start their presentations. Ed Harte is one of our panelists, has worked with ICT, with the National Health Service executive in Ireland for 17 years, and most recently has become involved with the EU projects such as the EU Irish Open NCP and the Digital COVID Certificate implementation. Panos Louridas is working as the Director of Research and Development at the Greek Research and Education Network, heading the effort for the development and deployment of the EU Digital COVID Certificate in Greece. Fidelia, and I'm probably going to say this wrong, but Cascini, she's an advisor of the Directorate General in the digitalization of the Italian Ministry of Health and involved with the European and international activities for digital health. She's an Italian member of the Global Digital Health Partnership. And last but not least, Ron Roozendaal is the Director of Information Policy and CIO of the Ministry of Health and Welfare and Sport. He's responsible for the international policy in the healthcare sector of interoperability, functioning of the Dutch Healthcare Information Council and Quality Assurance. He's also the Dutch Global Digital Health Partnership representative. So with that, I'll let the panels take over. Not sure who's going first. Ed, would you like to go first?
Sure, Didi. Yeah, that's no problem.
Thank you.
I just see now.
I think you'll be presenting your slides, and I think Lloyd, who's helping us behind the scenes, have the rest of the panelist slides all together, so he can drive the slides for the other panelists if needed.
Okay, so you want me to present my own, Didi, is it?
Yeah, if that's okay.
Oh,
we didn't get it in time to merge them, so
no, that's absolutely perfect. Just hold on one moment till I share my screen.
No worries. Thank you.
And just, I hope you can see my screen now, everyone.
Yes.
Yeah, perfect. Thank you very much. Thank you, Didi, for the introduction, and good afternoon, everyone. And thank you to the IHE team for giving Ireland this opportunity. I work with Eamon Coyne, who a lot of you from the EU perspective will know, and Eamon is otherwise engaged, so he gave me this wonderful opportunity to speak on Ireland's behalf and explain a little bit on our implementation of the Digital COVID Certificate. So for those who don't know, the COVID certificate is a health document that enables free and safe travel during this pandemic. And the content of the certificate itself can contain information about your vaccination, a negative result, or a recovery result. And a recovery result is a negative test not earlier than 11 days after a positive, and it's valid for 180 days. So the key features of the certificate itself, one of the main features being it's free of charge to the citizen. It's available in digital and paper format. It comes with a QR code, which Jürgen spoke about earlier. It's in the national language and in English. It's safe and secure and is valid in all EU countries. So, as I've said earlier, it contains the QR code to prevent it being falsified or reproduced by a non-verified authority. And the QR code itself can be verified by an authority who is associated with the EU Digital Verification Gateway. Each issuing body has its own digital signature key, which are stored in a secure database in each country. And during this process, the European Commission built the gateway. It helped the member states develop their national software and applications to issue, store, and verify the certificates, and also supported each member state in the onboarding process, which was the scanning verification of all the QRs and all that went behind that. So just to give you a little bit of background on the Irish side of things, the Office of the Chief Information Officer was established in approximately 2014. About a year later, there was a knowledge and information plan, which was developed. And central to that, on the left-hand side there, was enterprise architecture, standard-based terminology management and governance, all the good stuff that we like there. And central to that also was the national contact point, which lay down the cross-border exchange of patient data between the EU and the member state, Ireland in this case, and all based on standards-based infrastructure. So it was used as a linchpin then to feed all other healthcare systems within the Irish eHealth infrastructure. So the Open NCP, the portal itself there was based on XDS architecture, and the supporting infrastructure fed all the clinical systems and also enabled the exchange of data and the EU electronic healthcare record. So if I just go back one, that was our infrastructure there. And when the ask came in then to implement a digital COVID certificate, we leveraged the XDS infrastructure that was already there. We ensured that the use cases for the Irish digital COVID certificate were encompassed in that. And because we based that architecture on open standards, that enabled us to align with the EU requirements and also the future WHO requirements. So the gold boxes on the diagram there were what we implemented to allow the digital COVID certificate to work within the Irish infrastructure. So you will see there that the immunization and test result repositories, there were the service that read the immunization and test results, and they were capable of producing the digital COVID certificate based on the clinical records that they've seen. The immunization and test results themselves are standard-based. They're based on the HL7 CDA via the IHE XDS and XCA. And they're there for the continuity of care purposes and are available to the healthcare professionals within Ireland and Europe. And it's the same for the vaccination and test results, and they're able to be verified also. So to enable the digital COVID certificate as a service, it was capable of providing proof of the vaccination and proof of recovery and negative test results as per the EU requirements. And the service itself was dynamic and relied on clinical data within the repositories. This also gave the Irish citizen control and empowered them who could access their digital COVID certificate and the information therein. and the vaccination and test result records for medical purposes, and they were also standard-based and also available through the IHE standard XCS and XCA. And again, they were also available through the Open NCP, which is the cross-border exchange of data. So the Irish Digital COVID Certificate, as well as Jürgen had mentioned earlier, is based on the HL7 FHIR, and it is a self-contained bundle itself. It's available as structured XML and can be transformed into various presentations also. And we've incorporated the JSON, CBOR, the COSI, ZLib, etc., as per the EU requirements within our own implementation of the Irish Digital COVID Certificate. And it is presented in various representations via web portal, email, via mobile application, and via post. And there, the printed paper example there that is conforming to the EU standard, which is where it has been folded, so certain information can be held and the QR code can be signed. And as was touched there earlier, that on the 4th of June, Ireland successfully completed the onboarding, acceptance and test requirements of the EU Digital COVID Gateway, which means that, as most people know here, that the rules from the country and from other countries can be validated against that gateway, and then due to go live then on the 19th of July, and we're set for that onboarding and testing period, which is the 24th of June. So that's the whirlwind tour of the implementation of the Irish COVID certificate, digital COVID certificate. As I said there, Eamon Coyne is leading out on that project, and that's his email address there, and that's my own email address there. For those who may not be aware, Ireland suffered a cyber attack there recently on our own health service. So our own health emails, like our work emails, are unavailable. So if anybody wanted to follow up with any questions, there's our own personal emails. So thank you very much, Didi, and I shall stop sharing my screen now.
Thank you, Ed. Wonderful presentation. Sounds like you have a lot of work ahead of you.
Yep, indeed.
Okay, Lloyd, I believe you'll be running the slides for us. I'm not sure what order, I forgot to ask you this morning what order the presenters are in the slides you pulled together. So if you bring up the slides. I believe, Lloyd, are you still back there?
Hi, this is Esther. According to the program, it's Panos Louridas' turn.
Okay, Panos, would you do you happen to have your slides, since we're not able?
Right.
There
yes.
we go.
Okay,
Perfect.
so I'm just transferring, so it should be okay now.
No worries. You are perfect. Thank you. We see Panos' slides now.
Right. So I'm going to talk about the Greek experience, which is, well, it's similar to the Irish one, since we are working again on the DCC. Although there's a slight difference that we have already got into production. So we started issuing and verifying the digital certificates, COVID certificates, from the 1st of June. Just a brief overview of how it is done. There is a central government services portal in Greece called gov.gr, where citizens can go for all kinds of government services. So we have thousands of government services that are available from there. And there's a single point of authentication using their tax records. So they go there, they authenticate to their familiar portal. And after they authenticate, we take their name, surname, and date of birth by an API from the police records. The police record is where data on passports and IDs are kept. And this is because the digital COVID certificate is meant for people, is meant to be used also outside Greece. So the name and the surname must be written in Latin characters, otherwise it will be all Greek to you. And the only way we can assure that the name is exactly written as on the passport is by taking the information from the passport. So the first thing that happens is that we take the information from the passport registry and we fill it in. Then we interoperate, we have another API call from the health authority where we get the vaccination, the test of the recovery status. Luckily, Greece, the situation is centralized, so there's only one authority and one vaccination registry. So we only have to interoperate with them to get all the data we need. Then we wrap everything in a JSON format, as I said before. We digitally sign the information, and then we create a QR code. So this is actually how it looks like. You saw it before, I think. This is a sample. So you and as you can see, the actual certificate is the small QR code that you see on the upper right corner of the screen. All the rest of it, which is humanly readable, is just for the carrier of the certificate to know what is written on it. But what actually counts and what is actually verified is only the QR code. So this is a sample one, and I also have my own because I have completed my vaccination. So I was also using with my own digital certificate, and I'm very, very proud for that. Now, once you have that, then the next thing is that you scan it, that can be scanned using an application. So you have an application that runs on the mobile phones and tablets. So it runs on iOS and Android tablets. So I have it, for instance, right here. And it verifies that the QR code is signed by one of the approved digital document signing certificates, so that we know that's a valid certificate, and it displays the information. And based on the information that is displayed, then you may be permitted or refused entry to the country. The way this happens, and I think the previous speaker also said that, is we share this document signing certificates the member states among themselves by using a central gateway run by the European Union. So there is a process where we create these document signing certificates, we upload them in a secure way to the certificate gateway, and then these are downloaded to the national backends from which the mobile apps, like the one that I have in my hand, can get them so that they can check the signatures and find out that they are valid and determine that they are valid. Note that the checking of the certificate is actually done offline, so you don't need an online connection to check the certificate. You only need an online connection, let's say once per day, to update the signing certificates. Once you do that, then you can go with the tablet and mobile phone anywhere and check the QR codes for the people coming into the country. So this, as I said, this has been in operation since the beginning of June 1st. From the beginning of June till yesterday midday, we had almost 400,000 vaccination certificates issued. Right now would be certainly more than that. It's a very popular, more than we expected. And remember that Greece is a small country, so we're about 10 million people, and I don't know how many of them are planning to travel anyway. So this has proved to be very popular. So we have about 400,000 vaccination certificates issued in the first 3 weeks, then 5,000 testing certificates is people with PCR tests, and 28,000 recovery certificates for those who have recovered from the disease. We also have, if you are not able for any reason to get the certificate online by the gov.gr central portal, you can go to the citizen service centers. These are citizen service points that exist throughout the country, and where you can go and carry out various administrative tasks. So some people have also gone there. So we have about 30,000 vaccination certificates issued by the citizen service centers and not through the portal, for example. So all in all, that was a success, and few of the lessons learned that I think could be of interest to the people attending. I said Greece was the first wave of countries issuing and verifying DCC. So there were a group of 7 countries that went live on June 1st. Now, to do that, this was really a grueling task. It was really a death march. So we had to work night and day for about a month in order to do that. And it was only possible because it was built on existing functionality. For instance, I mentioned that we have the gov.gr central portal, where we already have a mechanism for issuing certified, meaning digitally signed documents for all purposes in Greece. And we have issued millions of documents the last year, digitally certified documents in Greece. So this was just another document. And in fact, we already had, before this European certificate, we already had started issuing our own national certificates for about a month before that. So we had the mechanism in place. What we had to do was to ensure that we interoperate and we follow the European standards. That meant that we already had interoperability with police, and we already had interoperability and APIs with health authority data. We did not have to develop that from scratch. These were already in place, and I think it's very important to ensure that you have these APIs with the various actors with which you have to interoperate. And the other thing is that, of course, in order to arrive there, we had an extraordinary amount of cooperation between member states. I personally, there were days where I attended 3 meetings in a single day. So although it is not my main task in my job, it definitely felt like it was a full-time job, just ensuring that everything would happen in the right way, in the right time. So now the system works, and the question now is actually, it looks a bit tangential, perhaps, but let me just refer to, there was a very public British intellectual called C.P. Snow a few years back, and he wrote a famous essay, The Two Cultures, where he mentioned that there was a divergence between technology and science and the humanities. And these two different communities had started talking different languages. What we have started witnessing here is that we have on the one hand the technologies, which is, well, I am a technologist, and then on the other hand, we have the people that are trying to find out how the certificates are going to be actually used. I'm talking about data protection agencies, lawyers, etc. So the discussion between these two communities has just started in Greece, and it's becoming a very, very interesting one. As I said, the certificate started because to facilitate travel inside the European Union. But once you have the certificate, why not use it, for instance, inside the country? You could use it to, for instance, to relax measures in concerts or in big sporting events. But then you have to explain everything to the lawyers in order to get a permission to do that. So technologically, we are ready to roll out a certificate, even for internal use, to make sure that we don't need to go into any kind of generalized lockdown like we had until a couple of months ago, but to allow a much better nuanced approach to how we deal with the coronavirus in Greece. But we have to communicate with the people on the other hand, which often speak a very different language. And as I said, this has proved to be a very, very interesting discussion to this point. So this is what I had to say. Okay. Thank you.
Thank you very much. Wonderful presentation as well.
I see a question. Sorry, I see a question that says, as a tourist destination, does Greece have a strategy? Should I answer now?
Yeah, we're going to hold those to the very end, if that's okay. There is a Q&A session at the very end that's going to be moderated as well.
Okay, great.
Thank you. So I believe, Fidelia, you're up next. I don't know if Lloyd has your slides up.
Yes, I can share my slide. Can you see my screen?
Yes.
Okay. I try to. Okay, this is full screen. Okay, can you see the?
We can see it. Perfect. Thank you.
Okay. Good afternoon, everybody. Thank you, Didi, for your presentation and for giving me this opportunity to speak about the Italian experience. In Italy, we have a centralized system, and also about the COVID vaccination, governmental authorities cooperate, and in particular the Ministry of Health as a coordinator and data controller with the Ministry of Innovation and Digital Transition and Ministry of Economy and Finance, especially those two for infrastructures and organizations of the platform platforms to create a national platform dedicated to the digital COVID certificate. This national platform, which is controlled by the Ministry of Health, is fitted by 2 other platforms, depending on the type of information. Because in Italy, the certificate is about the vaccination, but also the other 2 information concerning the test results, which should be negative for sure to go around, and the recovery certificate. For what concerning the vaccine result, the vaccination, we have a national immunization and information system which collects all the data on vaccine campaign advancement, and which is fitted by the regional vaccine hubs during the vaccination campaigns. The healthcare system, which is also another platform for data concerning swabs results and recovery certificates, is fitted by healthcare laboratories and general practitioners distributed on the regional territories. All this information are collected into the national platform, and then the citizen could ask this platform to download his personal COVID certificate. What are the features of these digital COVID certificates? It is a 2-dimensional interoperable barcode certificate, which is based on technical specifications approved by the eHealth network at the European level. We have also an app named Verifica C19 to check the authenticity, the validity, and the integrity of the certificate. And we have different times of validity, of expiration concerning the validity of this certificate. In particular, about vaccination, in the certificate are reported all the information concerning the vaccine, the producer, and the type of vaccine, for sure, because in Italy, we, as in other European countries, we don't admit all the possible vaccines. So the certificate report the name of the vaccines authorized, and also the certificate is available 15 days after the first dose of the vaccination, and the expiration after the second dose of the vaccine is 9 months. If we speak about the negative test result, and in particular the rapid antigen test results, it should be related to a specific type listed in an authorized list of antigen test, and its validity is 48 hours. About the recovery from COVID-19 infection, it must be certified by the general practitioner or by an hospitals, and its validity is 6 months. What are the digital access points to download these certificates? We have different points, in particular the digital certificate can be downloaded by the healthcare system web portal, the health information exchange web portal, which are the 2 national portal under the authority of the Ministry of Health, and then also using 2 apps, the app Immuni, which is the same app of contact tracing, and also the app IO, which is an institutional app for administrative activities concerning the citizen. Other possible channels, for instance, for citizens who don't have a compliance with digital tools, are general practitioner who can download the certificate when a patient is asking for this, and also the pharmacists. When the certificate become available, and it means that vaccination or test or recovery is done, the citizen receives a one-time password to download the certificate from the healthcare system web portal or using the app Eamon. In the other cases, and I mean the other points access, as the Health Information Exchange web portal, it's possible to download the certificate through the personal ID. Finally, the certificate could be revoked, and it means that it is invalidated before its scheduled expiration date when the vaccinated or recovered person would become a confirmed COVID-19 case. Laboratory test will confirm this positive result. Local public health services and general practitioners can transfer this information, should transfer this information to the national platform to activate the revocation process of the certificate. And also this revocation, this communication will arrive to the European gateway to inform also the other European countries following the same rules. And that's all as an overview for the Italian system. Thank you very much.
Wonderful presentation, Fidelia, again. So our last presenter is actually Ron Roozendaal, and I believe Lloyd is going to be presenting your slides for you.
I hope so, thank you.
You'll need to let him know when to advance.
Well, please advance, Lloyd, thank you. Thanks for having me. You had so many presentations on the digital COVID certificate that will pass much of my first slide. So could you please pass and I'll say when to stop. Oh, please next. Yes, next. Next. Well, I can stop here. Many of you have heard that there is a lot of data protection around the digital COVID certificate, which is true, but as member states in the EU have their own rules, they are all needing all of the data. So what people present is all of the data. It's about a recovery, about a test, or about a vaccination, but it's all of the data. And I will go into what we do for domestic use, where we do not use all of the data. Could you please go to the next slides? Next, please. Next, please. Because we started this just before the digital COVID certificate was started, and we wanted to be able to relax the restrictive measures, but with access to specific facilities based on proof of lower risk of transmission and based on a legal framework to regulate when the display of the certificate is mandatory. And we now also add vaccination to that. Can I have the next slide, please? No, one back, please. Oh, no, sorry, yeah, okay, one back, please, sorry. Next. 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 Sorry. So what we did is we started the development of two apps. The Corona Check app, which has the digital test certificate used by the citizen, and the Corona Check Scanner app that is provided on the App Store for everyone to use, but can be used by the event organizer to scan the QR code of a visitor. And there is only one app allowed by law. So it's in the law that for testing to access an event, you have to use this app. Can we go to the next slide? And the requirements were that it is privacy security by design. So for example, people should not be able to be followed from event to event. So the QR code, for example, changes every few minutes, so that if you photo, if you make a photo of the QR code, it's not valid on the next event is one. And there is no link between the different QR codes used. So there is no fixed QR code as the GCeHI has. So we cannot follow Dutch citizens over visits to different events. It should be accessible. It's open source on GitHub. People can follow the code. It's for the pandemic only. It's in law. It'll be ended after the pandemic has ended, and there's a kill switch in the app itself, and it should be able to withstand various threats and abuses. Can I go to the next slide, please? So for a visual example, you see that people generate a QR code, and on the right, you see the data that the verifier sees. And it's at most 2 initials, the day of birth and the month of birth. But if the initials are rare, you see less. So in this case, the second initial might have been a Q. And in that case, the initial is removed so that there is a large enough group of people with this combination to not be able to tell who it is. Can I go to the next slide, please? So in our app, we will have 2 modes. We will have a domestic mode and a EU mode. Can I go to the next slide, please? And in the EU mode, there is much more information. And people can click a button and see what information is in the QR code, and it's a lot more than in the domestic use code. Can I go to the next slide, please? So to see the difference, for domestic use, there is a first letter of surname and forename and day and month of birth, and that's it. The certificate has a validation range in dates, but that's it. And the government states that within that date, there is a valid reason to be able to enter an event. It's not even told if that's based on a negative test, on recovery, or vaccination. Whereas if you cross a border in Europe, to be able to apply rules of the country you travel to, the country has to have all the data. So the difference between domestic use in the Netherlands and cross-border use within Europe is providing the verifier with a lot of information. Can I go to the next slide, please? And our key learnings is it's an open development process, which is not traditional in government. So it's on GitHub. We use community contributions a lot. And the effect of that is amazing, both in trust and in code base. We do privacy security first. So within the Netherlands, consent is not seen as sufficient legal ground. So there is a law where the function of these apps is explicitly grounded. And developing this also triggers policy decisions on what data to use and what not. But that brings us with the challenge to combine 2 different QR codes, one for domestic use and one for cross-border use as designed within the EU. And as many before said, in a decentralized healthcare system, the challenge is to gain all that data from all those test providers and healthcare organizations who keep vaccination records, etc. And that's my part of the panel presentations.
Thank you very much, Ron, for your presentation as well. So we've heard from our distinguished panelists, and we're very grateful for their supporting this effort. And again, on behalf of the Global Consortium for eHealth Interoperability, Jürgen and I are the 2 executive board members from IHE. And I have the pleasure of introducing you to Walter Suarez, who is one of the HL7 representatives on the executive board. He's the chairman of HL7 board of directors, and he also works with Kaiser Permanente here in the States, working with policy, standards, and regulations. So with that, Walter, I'm going to turn it over to you to be able to facilitate the Q&A. I see several questions that have queued up in the chat window. If anyone does have questions, please make sure to either enter them into chat or feel free to unmute yourself and ask the questions as Walter facilitates. Walter? Walter, we can't hear you yet.
Yeah, sorry, I was double muted. Can you hear me now?
We can, thank you.
Yeah. Yeah, but no, I was just saying thank you very much for these wonderful presentations. A real incredible example of how each country within a framework inside the European Union is progressing towards and actually implementing already the country level vaccine certificates and in a interoperable way across the European Union. So thank you very much for those presentations. Yeah, we do have a number of questions, and I want to also invite my co-moderator for this session, Amit Trivedi, who is with the HIMSS organization, the other partner in the Global Consortium, to work with me on this facilitation of the of this Q&A. So we do have, as I was saying, several questions, and I will start with probably one that a lot of people have in mind. So it looks like you know, within the European Union there's quite a bit of cross-country interoperability by virtue of using the same type of framework. The question becomes, what do countries see as opportunities or challenges when it comes to a certificate coming from outside of the EU, for example, the US or some other country outside of the EU? How does the current approach works in those cases? And it might not be ready to be implemented with other countries outside of the EU, but what are some of the perspectives from the presenters about certificates from outside of the EU?
I can answer for Greece if you want. So first of all, Greece accepts also vaccines apart from those that apart from the ones approved by the European Medical Agency. So we also accept the Sinopharm and Sputnik vaccines. And it also accepts the certificates issued by countries outside the European Union, provided that, well, I think there are some specifications. The certificate must be in English, or it must be in one of a few languages, I think. So the answer for Greece is that yes, we do accept certificates from outside the European Union.
Thank you, Panos. Any other member of the panel want to answer that?
Yes, if I add to that, the European Commission is now talking with ICAO and WHO for about the interoperability of all the different certificates worldwide. We did introduce a number of talks from the start where the discussion about what data elements are we all registering, and what data elements do we need to share with each other. That's one. And secondly, what signatures do we use and exchange to be able to see if a certificate is signed with a valid signature. So from the start, there were lots of discussions about interoperability. For me, the most important point is within the EU, we have the EU law about what data you may process. So that, for example, you may not store the data that you verify. And we have to make sure that if we travel abroad, and that is Americans travel to Europe, and can be sure that the data they show is not stored somewhere for later use, but also Europeans travel to different countries in the world and can be sure that the data they present is not stored and used or abused.
Great, thank you for that answer. Last check to see if anyone else from the panel want to answer that question from outside, from interactions with outside of the EU. Okay. All right. We'll go to the next question. Amit, I don't know if you would like to
Sure.
ask a next question. Go ahead.
And somewhat related. And so Ron, thank you for your presentation. I think you talked about your use of different QR codes for both domestic versus cross-border uses. And so this relates to, I think, a question that was asked in the chat log, and I think may apply to, it applies to everyone. What audit or provenance log is preserved nationally to indicate that a vaccine credential has been issued? And as you touched upon, there may be different laws regarding what data is preserved or not, but that really speaks to the question you had for everyone in terms of what data elements are we using and sharing, and can we get some agreement on that, I think.
Well, I think that what we did in the eHealth network in the European Union is standardize that EU-wide. And we did that so fast and swiftly that many of the work now done outside of the EU is based on that work. And I see, lots of the same data elements in all of the certificates now designed worldwide.
I can also give some information about what the situation in Greece. I guess it's similar to other countries' discrimination. So it's a certificate. Well, the only way you can check the validity of the certificate is by checking the digital signature. Okay, this is the only way that you can say that the certificate is valid. Now, the certificate itself contains also a unique number, a unique ID called UVCI, and this is the same throughout all the countries. So all the countries are supposed to put a UVCI. The reason for the existence of the UVCI is that it can be logged so that a particular certificate can be traced in case something, let's say, bad happens. For instance, let's say that we have it transpires that some stock of vaccine is, does not work properly. So we have to revoke this. So we have to find out which were the certificates so that we can revoke them. That's why the UVCI can be used for. It cannot be used for validation. It cannot be used for tracing. And as far as I understood, the raison d'etre for introducing the UVCI is for being able, for instance, to revoke certificates when it turns out that they should not have been issued.
Thank you, Panos. Any other panelists want to chime in? And if not, perhaps Walter, another question?
Yeah. So one of the challenges that we have, I think, is, and this is about a question also in the chat, that some people, for different reasons, might not be able to have a legitimate, or may not be able to have a vaccination, whether it's medical reasons or other reasons. So, and in general, I think we have talked during this conversation about three major policy issues around certificates: privacy, security, and this last point, which is equity. And so with respect to equity, and considering that there are some challenges with respect to who can or want to or choose to have or be vaccinated, what are the types of steps that are being taken by countries to address this question about equity and the challenges of not having, for valid, legitimate reasons, everybody be vaccinated? Any reaction, any comments?
Yeah, well, a very good question. Thank you for that. We in the Netherlands decided there should not be any press on people to get vaccinated. I totally agree for that, on what reason whatsoever. From the 1st of July, every citizen above 18 years old can be vaccinated. But what we do is, and the EU does that too. You might have had a recent negative test. You might have had COVID. or you might have been vaccinated. All the three may lead to a certificate. That's one. And in the Netherlands, and that's true for most countries in the EU, testing for travel will be free. So that if you travel, you go on vacation, and a country where you travel to requires a negative test or some other proof, a negative testing for that is free in the coming month.
Great, thank you. Anyone else from the panelists?
It's almost similar in Greece. So yeah, it's almost similar in Greece. So if you can't get vaccinated, you have to provide one of the other two certificates. So this is not a technological decision, this is a policy decision. And I guess it will apply to the whole of the EU somehow.
Okay. So in many ways, the way to address the possibility of having people not be vaccinated for legitimate reasons or choice, there is the negative test alternative, I guess, is one way to address it. Correct? Is that one way?
Although there's a proviso here that there's a big discussion here in Greece, for instance, now that we have universal access to vaccination, if you don't get vaccination by choice, then of course it's a big question of why you should have, if actually you don't have access to free tests, because if you don't, vaccination is free. So if you decide not to get vaccinated, why should you get free tests all the time? I mean, PCR tests, you can get rapid tests for free. We provide them for free, but not PCR tests for free. And there's big discussion in Greece about offering, let's say, carrots. So let's say privileges to people who are vaccinated, in order to make the decision to get vaccinated more appealing. So we're talking about those that have the choice and choose not to vaccinate, right?
Great. Thank you, Pat. Let me turn it back to Amit for the next question.
Sure, and I think that last question kind of points to that the thorny issues, between policy and technology as well, right? When we talk about health equity, there's the issue of do folks have access to the vaccine or vaccinations? The other question is, how do we digitally or otherwise indicate that there are legitimate medical reasons folks can't be vaccinated? But that said, I think there were a couple questions in the chat with regards to the digital certificate and revocation. And Panos, I think a couple were directed to you specifically in terms of how revocation is supported, especially in the offline model.
Right. So the answer is right now it is not supported. So this what has been put into production from June 1st is version 1. So in July, there's going to be a new version with some different rules and validation criteria. And the revocation API is something to be determined. There have been discussions about how this will be implemented, but it has not been implemented yet. Talking about implementation, I think there was also a question about who implements the digital gateway, the European digital gateway. Well, this is operated by the European Commission. From what I know, the implementation is carried out by a contractor, it's T-Systems from Germany, who implement the digital gateway. And they have put the code on GitHub. So, and also they have put the reference implementation for various stuff on GitHub that the member countries can or cannot or may choose not to use. But the implementation is by T-Systems. And I see also a question that experience of this signature. Yes, well, it's one thing to revoke something, and a different thing for the signature to expire, right? So the certificate itself has an expiry date on it based on the expiration of the digital signature. This means that the certificate is technically not valid anymore. It does not mean that you are not safe from COVID after being vaccinated, right? It's a technical matter of how long this digital signature is valid. So yes, this has an expiry date on it.
So maybe we can spend the last 3 minutes here asking each of the panelists if they have perhaps one parting thought about vaccine certificates. What would be the most important next step that you see in terms of achieving interoperability worldwide, for that matter? What would be that most important next step? And so we have about 3 minutes for each of you to make a very brief 45-second statement. Who wants to start?
Thanks, Walter. I'll Ed here. I'll just jump in. The main thing from our own experiences is cohesion, standards-based, ensure that there isn't any doubling up of efforts within governmental agencies, and make sure that there's a clear strategy and direction going forward. That would be my advice to ensuring the delivery of the digital COVID certificate.
Great, thank you.
Shall I add then my two famous last words to that? What I hope is that we arrive in a situation where we, when traveling, are not getting used to show all our medical data, but where we, in bilateral conversations, can agree on that if I enter the US, just a statement signed by the Minister of Health of the Netherlands that I have a low risk of transmitting the virus is enough to enter, so that we trust each other, that we know that there is a trustworthy declaration of lower transmission instead of showing all our data all places we travel to. I hope we come to that.
Great point. The importance of trust across countries. Thank you. Panos, would you like to
one interesting
give us a
development.
last view?
Yeah. One interesting development that actually happens in this month, in the next couple of weeks, is to encode the so-called validation rules, which means that we know that the certificate is a genuine certificate. Does it allow you entry to a specific country? So each country has to encode the rules they apply, and the decision has been made to encode them in a machine readable way, so that it will be possible even before departure to check if your certificate allows you entry to any of the destination countries. So this is a very, very interesting exercise. It also requires a lot of international cooperation.
Great, great. Thank you so much. I think we have one more panelist.
Actually, I think she had to drop, and so I think that might be it for the group today.
Okay, all right. Well, on behalf of Amit and myself and the rest of our Global Consortium for eHealth initiative, I want to thank you all for joining us today. A special thanks to our 4 panelists, great presentations, amazing examples of how each country is moving forward within a common framework to ensure a very important level of interoperability across countries. So thank you so much again, and an invitation to join us later this day for the second session that we will have. I believe it's in about a couple of hours. So thank you so very much, and have a wonderful next few hours, and look forward to seeing you all. Thank you.
Thank you very much.